A possible treatment for those suffering from COVID-19 has brought renewed scrutiny to Canada's blood donation ban for gay and bisexual men. Clinical trials to study whether convalescent plasma can help fight COVID-19 are underway as we speak. Plasma, the liquid portion of blood, is collected from people who have successfully beaten the virus to treat people who currently have it. But this country's blood donation policy means men and trans women aren't allowed to donate blood if they've had a sexual encounter with a man in the last 3 months. Advocates say the ban is discriminatory. In 2015, Prime Minister Justin Trudeau promised to end the ban. Earlier today, he was asked why he hasn't kept that promise.
Our decisions from the very beginning have always been anchored in science and data. From the very start when we took office, we made significant changes to shorten the wait times, but they were still unacceptable. That's why we gave funding to Canadian Blood Services and IMA Quebec to do the studies necessary to be able to bring in new protocols, and we are very hopeful that we'll be able to announce the results and the change very soon.
For more on this, I'm joined by Randall Garrison. He's the NDP's critic covering issues related to sexual orientation and gender identity. He joins us from British Columbia. Christopher Karras is a human rights advocate and is currently challenging the blood ban before the Human Rights Tribunal. He joins us from Toronto. Hi to both of you. Thank you very much for making time for us.
Hi, Vazzy.
Mr. Garrison, I know that you've introduced a motion for the second time on this, but before I ask you about that, I do hope that you can help our audience understand the origins of this ban.
Well, as we go back in history, more than 30 years ago, at the time of the AIDS epidemic, we really didn't know the cause of AIDS. And so people like me who are regular blood donors stopped donating until we figured things out. And a ban went in place formally in the early 1990s. But the ban has been out of date scientifically for at least 20 years now.
Mr. Karras, tell me about the challenge that you have before the Human Rights Tribunal to this ban.
So in 2016, we filed a federal legal challenge to challenge this issue head on and challenged both Health Canada and Canadian Blood Services blood donation policies to hopefully eliminate these policies. And I think it's important to note that today of all days, it's important that we see the elimination of these policies as we are still mourning the loss of the 49 people who died at the Pulse nightclub. So I think that it's still a very important issue that needs to be brought to the forefront, and I hope to see much more change on the horizon.
And Mr. Garrison, your motion aims to bring it to the forefront in light this time of COVID-19 and the discussion around the treatment that we outlined in the introduction there. But you had introduced the motion prior as well, correct?
I started these discussions with Canadian Blood Service when I got elected in 2011. And the first conversations we had were about the things they needed to do before they felt they could lift the ban. Those were never funded for quite a few years, but they were finally funded by the Liberals in 2016. And so all the science, all the research, all the protocol development was supposed to have been done by January of this year. I believe it is done. And so now, particularly in this time of the COVID crisis, when we have blood shortages and when we need the plasma for research and possible treatment, it's time to lift the ban.
And what is procedurally, where does your motion sit right now?
So I put it on the notice paper in the House of Commons, and I've asked for support from other parties, and we appear to have cross-party support for the motion. So what I'm asking the government now is whether they would support giving unanimous consent for this motion to proceed.
So we're waiting on that answer.
Well, yes, I didn't get any kind of an answer when I asked them yesterday at all.
Okay. Mr. Karras, you heard the Prime Minister's response to, he actually received a number of questions on this issue. The government has reduced the amount of the deferral, like the time that you have to wait to 3 months. But obviously the promise in 2015 was to get rid of it altogether. What do you say to the point that he put forth around the science around it? There are 15 studies being conducted, as Mr. Garrison points out. They were to have concluded in January. Is the science unsettled on this? Because my understanding is other jurisdictions have gotten rid of this ban.
So what I thought was really interesting about what he said this morning was that he was hoping to anchor these policies in science And yet all of these policies are not anchored in science. They haven't been since their inception. And so I'm hoping that we will anchor this in science, and that we will move towards a behavior-based model that is gender neutral, that does not identify people, and that is more inclusive, so that more people can donate and allow people like Adam Capriolo to actually donate when we need them most. And, you know, the effects of this are much greater now with COVID-19 than they've ever been. We've seen with organ and tissue donation that over 200 people die not receiving the organ and tissue donations that they need. And with blood donation, it appears that these numbers aren't even being released. So we don't even know what the effects are in regards to blood donation. So the impacts are great, and we need to do something now. And we can't just rely on another promise for an announcement, and who knows when. When will these policies be eliminated? There are still policies that are barring people of color and other groups, and there is so much more work that needs to be done. I don't understand why we haven't done this yet.
And Mr. Garrison, I think it was in an article I read in which you were quoted around other jurisdictions, you know, that the idea that the science isn't settled, other jurisdictions have settled it.
So 19 years ago, Italy eliminated the kind of identity-based exclusions that we have and went to behavior-based exclusions, which are pretty simple. They say when you change sexual partners, or if you have multiple sexual partners, there's a deferral period. And that applies to everybody, no matter what their gender, no matter what their sexuality, because that's risky behavior, not just for HIV, but for other sexually transmitted diseases and for things like Hep C. And we've got 17 countries, I think I need to up the count to 18 this week, who've eliminated these restrictions, and none of them have had problems in their blood supply. There is no science behind this ban. There never has been. There was no science behind the reductions in the waiting period, which are actually a bit absurd, because if you know anything about human sexuality, a deferral of 5 years, 1 year, and several months are pretty much all the same thing. They mean a ban on the donations.
Okay, I have to leave it there. I'm out of time. The show's about to end. But thank you very much, both of you, for your time this evening. I really appreciate it.
Thanks, Nancy.
Thank you.
NDP MP Randall Garrison and human rights advocate Christopher Karras. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.